Now another which is very important is Sialadenitis. So let's start it. Bismillahirrahmanirrahim. Sialadenitis is basically the inflammation of the salivary glands. It due to bacterial or viral allergic reaction or irradiation can be a possible cause of this. Sialadenitis occur as a result of decreased salivary flow or inflammation or blockage of the salivary duct. When there is actually blockage in your salivary glands, either in parotid, submandibular or sublingual region, okay, then affects major glands, but at a time it affects the minor also. The minor are like primary. There is minor glands. They affect when it is primary Sjogren's syndrome, and secondary is the pap smoker's palate. Okay. Then causes of Sialadenitis, which I have told you, it can be in bacterial. In bacterial, we study actually ascending Sialadenitis and recurrent parotitis of childhood. Very important, Sialadenitis, it is ascending infection and it can be recurrent parotitis of childhood. Okay. Then in viral, we study about the mumps or parotitis, paramyxovirus and coxsackie A. Before we studied about bacterial, and then now we are studying about viral. Okay, now viral worms. It is basically common in parotid. RNA paramyxovirus and direct contact or droplets. It can also basically spread through the saliva and also through by urine also. Okay, it can also be spread by urine also. Okay, then paradromal symptoms was malaise and abdominal pain. Paradromal symptoms is actually a symptoms that occur before any disease. So a patient has malaise, weakness, abdominal pain. Saliva of patient developing mum is infectious for several days before parotitis develops and 2 weeks after. Means developing mumps, their saliva is totally infectious, through which it can be spread also mumps, and before parotitis which develops and 2 weeks even after also, followed by swelling. Means there is now infectious saliva. Then there is the saliva of one or both of the parotid glands can occur, and sometimes of some mandibular gland as well. There is pain. The patient complains of the pain actually. Okay, there is tenderness on touch. There is a pain. Malaise is there. Fever is there. Trismus is there. These are the associated symptoms. Complication is orchitis or orphiritis. Basically, these both are the inflammation of ovaries, and basically the one is the inflammation of ovaries, the other is the inflammation of the so orchitis is basically inflammation of testes, and orphiritis is basically inflammation of the female ovaries. Then basically it is actually pain. Remember it. Tetanus, pain on touch, malaise. Okay, then patient feels fever and also trismus. Very important thing, means the patient cannot open its mouth. Maximum swelling, means the swelling reaches to maximum when it after 2 days, and resolution after 1 to 2 weeks. Diagnosis on the symptoms basis. Okay, then okay, treatment, bed rest. Okay, you will do bed rest. You will tell the patient to do bed rest. Antipyretics you will give for fever. Okay, analgesics you will give for the patient to for pain. You will isolate the patient. Okay, this is lifelong immunity, means if the patient suffers from one attack, then it is a lifelong immunity. Prevention is through the immunization, which is basically you will give vaccine to that patient actually. There is no specific treatment. Okay, now